First of all, I would like to thank the chairperson, Dr. Nos Maslina, for inviting me to share our experience in this particular project that we had. Before I start, I would like to acknowledge my team member that I have Dr. Ayu Akida and Dr. Helmi as well as Dr. Loh, who have actually give me a lot of ideas and support when we wanted to implement this particular so-called COVID-19 adaptation. First of all, when we talk about medical education, I think the reason when we had our COVID-19 pandemic last year, I think that in the conduct of medical education, we often have a lot of concern because it's about how do we change the teaching and learning activity in the delivering of education, particularly when we talk about medical education, we have to emphasize the importance of patient safety and personal safety. Patient safety will be how do we actually conduct the training, we involve patients as well as the students' personal safety in going to the clinic and hospital. And I think most of our colleagues in the medical school, we had this problem because unlike any other undergraduate program, we have to acknowledge the importance because without any interaction which involve the clerkship as well as the bedside teaching, the clinical experience, we actually cannot deliver a safe doctor. So the emphasis is there, and our professional body have emphasized the importance of interaction. We cannot replace all this interaction with online teaching, online learning, and so forth. And because of all these issues of pandemic, we have actually delayed many timeline, and we have, I'm sure that all of you will have acknowledged that we keep on changing the teaching method, the delivery method, the assessment method, so that we can actually accomplish, we call it our PLO or the CLO of the program. But nevertheless, adaptations still have to come in because life goes on. That's why when we look at the conduct of our pedagogy of learning and teaching, we have to be very innovative. So when we use different type of teaching method, we still cannot compromise the aspect of, we call it interaction. Like I always say that clerkship as skill acquisition and relationship building is not something you can substitute into medical education. For that reason, we still have to practice what we call it physical distancing. We have to talk about the preventive measure, the no touching, no nothing, you know, that kind of thing, which actually in medical education is a very big challenge. So looking at that pipeline, in the medical education, I have to, how we started our medical program. In the medical degree itself, we have a lot of, we call it from the preclinical exposure to the clinical exposure. And one of the major things that we emphasize is looking at the community. I think that the university now also looking at community is a platform for us actually to engage with the people because it's human being behavior. We have to talk about that. So under the MDP 30609, Community Medicine and Public Health posting, we actually have some component where we required the student to have a face-to-face interaction with the community, where the students are expected to develop a research survey, conduct intervention program, as well as at the end of the day, we want to expose the student ability to convey all this information into a written. So besides putting up a research proposal, students are expected to produce a manuscript. And right, go back to what is our philosophy of teaching and learning in medical program. Two things we are actually emphasizing. One, we are looking at what we call it a professional identity development. We believe that under this professional identity development PID by Sean, 1983, the professional identity of medical student is formed through formal and informal exposure to experience during training. And exposing students to the life experience in their medical training help them to build up their so-called professional identity. This concept actually fit well for our community posting for this particular course, because in this particular course, we also emphasize another aspect, what we call it community-based education, where students are expected to learn, obtain professional skill and competency, where they have to apply their basic clinical knowledge and skill, interpersonal skill, lifelong learning skill, communication skill, leadership, management, evidence-based through their training in the community posting. So these two aspects actually have more or less given us some so-called inspiration of ideas. How can we move on? So as such, when we look at the professional identity, PID, community-based education, and students supposed to be able to express their experience and their, we call it through what we are emphasizing nowadays is reflection. So I was put in the situation during last year, during the fourth quarter of the year, where I actually oversee the implementations of so-called research component for this particular course. Over the years, what we did is that we exposed the student to a series of research methodology that involve survey research, and ultimately students supposed to conduct an intervention program at the field. So all these year 3 students will actually be posted to Cebu, where they undergo a training of few weeks, then followed by a community survey and conduct of intervention program. However, because of the pandemic or the movement control order, we were not able to conduct, but yet we are expected to complete. So our team actually have sat down and decided that we are not going to compromise in terms of the pedagogy of teaching, means to say that the content remained the same, students are expected to conduct a research. But then, instead of having a face-to-face interaction with the community, we have decided that perhaps we can look at what we call it visual representation or visual graphic narrative, because part of the intervention program, we expected to produce some form of intervention education tools. So this idea came in when I happened to Google this particular author, is Professor Green. He actually is an expert in looking at medical graphic narrative, a comic, we call it comic in a very layman language. Michael J. Green and Kimberly R. Myers actually thought that using a graphic medical or graphic narrative as a comic actually can help to educate the patients about patient care or management of disease. So what happened is that Green and Myers says you can actually using this method teaching to promote empathy, observational skills, foster awareness of the social requirement, which relevant to medical education. So in the Penn State College of Medicine itself, Professor Green actually have conducted his so-called comic courses to educate the medical student in becoming a better doctor, because their philosophy is that they want to promote character building, compassion and cognitive skill and manner. And the student at the end of the course are required to think on their feet while applying their knowledge onto comic, thinking that how to deliver message to the lay people. Now, this is some of the comment looking at how they have developed this idea, and I'm sure that if we were to have these comic courses in our university, I'm sure we will have, a lot of interested students who want to come forward and take the course. Now, what did we do under this particular course? Under this NDP 30609, we actually have allocated 30% of the assessment, where we will try to achieve the CLO of the posting. So before the changes, we actually emphasize three major components. There is student expected to produce a research proposal, a manuscript, and as well to conduct an intervention activity. But however, because of the movement control order, we have modified a bit. Instead of having the intervention activity, we convert that component into what we call it development of the health education tool. Right. What is new is mainly we wanted them to actually make sure they have done their research proposal, where they have to do a proper literature review. We expect them to come up with the health education tool. So in this case, for this particular rotation, we call it group of students, we have actually given the assignment that they're expected to create what we call it a COVID-19 prevention using comic. And the focus will be school children, primary school children. And at the end of the day, they're supposed to produce a manuscript trying relate their experience, how they undergo the process of developing these tools. At the same time, they're supposed to do what we call it oral presentation via online, which we did at the end of the posting. Now, what we hope to achieve at the end of the day is that they are expected to, what we call it, working as a group, because the issues is that they are all over Malaysia. They are not only focusing in maybe in Semarang or Kuching. So they have to interact using their way or means through social media, whatever internet, and then they have to work as a team to create the group dynamic and overcome their shortfall or conflict in achieving the course objective. Then they also have to have skills in conducting a literature search, identify the research objective, at the same time formulating all the research methodology in answering the research objective. And the concept, most important at the end of the day, we want them to actually to have an idea what are the concepts on delivering the health education via comic. And of course that the output will be in the form of proposal writing and manuscript. And they also need to defend the idea through proposal presentation and manuscript. And we hope that at the end of the course, they will be able to relate their experience and share with us how they feel that this process in their professional formation. So what they actually do in the whole process, that the student will have to engage the following skill, they call it under cognitive. They have to remember, they have to understand, they have to apply. In the effective component, they're supposed to complete the assignment work within the time given, participating in the group discussion, helping each other in completion, demonstrate problem solving, as well as commitment in the social development, systematic planning, cooperation, and then accepting the strengths and weaknesses of each individual in the group. They also expect to prepare and write all those things under psychomotor. And what make it interesting is that one of the member or the student in the group actually have the talent of drawing the comic. So what I'm going to show you later on, it will be is purely no copying. Is under intellectual property, mean is actually it belong to the group. Okay. Now this is the output. Okay, this is the output. The person who actually drawn this so-called comic is actually his name is Arif lah. He has the talent of putting up all these things. The challenge that we give them is that they have to make sure the information here can be adopt and adapt at the level of the primary school children, and it has to be all this in Bahasa, because we are targeting in the rural community. So they have done a good job. You can see that they have considered the simplicity of the message when they talk about how to convey what is gejala COVID-19, berjarakan social, and then as well as how to use a mask. So at the same time, they also play with the colors. Colors in the sense that because we are targeting primary school children. So all these aspects have been taken into consideration during the development of this commit. And we also have, after they have put up all these things, we actually ask the student to share it in the Facebook, just to gather some feedback from the community or their peers to see that do they actually think this is good. So there are some data pertaining to how many likes are when they look at this as an output. Then we ask them, how does this whole process actually help them? So some of them actually come back and say that, oh, I can actually find that this experience have made them understand different people from different ages have different level of understanding. So, and then they also say that they have gained more understanding knowledge on the topic and convey in a simple way to other people to understand. This skill is important because if you expect the student to go to the field when they want to interact with the lay people, how do you actually talk to the rural community if maybe education level is not so high? How do you convey in a simpler manner when we, in terms of medical education, like you want to talk about clinical symptoms, explain patients to all those things. Then they also talk about it make them more aware of the surrounding. It's not like they go to hospital, they enter the clinic kesihatan, that's it. But they are not in the what we call it a community base. And then they also talk about the experience have helped the student professionally. So how do we explain to the patient what are the communication skill, and then exploring the way to reach out to people where they find it, particularly when we look at the rural community, because rural community is the focus of our so-called the posting. The posting is meant for community and public health. And then they also talk about their experience. The most impactful experience is where they can actually create this comic together with the classmate, brainstorming the ideas, and then the designing, the producing, going through the literature, writing the manuscript, and then they also talk about how they create the storyline of the comic. Well, this is some of the assessment where we ask them throughout their experience, what is their perceptions of the attitude and skill with regard to this particular, we call it posting. So they talk about mainly the top three. They say that most important skill or attitude they actually feel they have gained is interpreting the information. That's 91.9%. And then they also talk about communication skill with the classmate, non-verbal communication skill, understanding patient perspective, and then they can actually describe a medical situation and so forth. So at the end of the day, we have accomplished our so-called objective on completing the posting, because this particular posting is only one of the group. In fact, we have another group actually developing the video and the song on COVID-19 in Iban language. So what is next? We talk about, at the end of the day, we think that comic can be a medium that actually can express narrative of ideas using some images as well as text that actually can play a role in medicine. And we might not think that graphic fiction is actually something that very serious, but in some of the ways in medical education or health promotion education itself, we realize that comic can be part of the paving a way to help people to actually reflect their experience. Most importantly, looking at the cultural perception. That's why I find that even though this pandemic actually have created inconveniences to all of us, but somehow rather it have accidentally forced us to rethink how creative can we be when we were actually put into that situation. So I think that medical educators should actually look at all this creative manner in helping the student to improve that their learning, or we call it medical education experience. So with that, I would like to say thank you. This is my final message, and I open for any Q&A lah. Thank you very much.
Okay, thank you, Dr. Cheah, for the what we call for the sharing. So, is there anyone would like to ask the Dr. Cheah related to alternative assessment that they are using in their courses? I have a question to you, Dr. Cheah. Since you showed that, since they are using the comic in order for them to do the what we call they are using comic in order to deliver the information to the community. It is Dr. Cheah?
Yes.
I see. So how they how what we call, what is the medium in order for them to deliver to the community? How they disseminate the information? Yeah.
Ideally, we expect this the comic can be actually produced in a form of posters, everything delivered to the schools. But because of during the time, the particular durations of the posting is the schools are closer. That's why we have wanted to find out what will be the feedback lah, if people looking at it as a way. So as I mentioned earlier, we actually posted this in the Facebook under the our community Facebook, and then we try to get some peer we call it comment lah. And some of them actually thought it was very creative, and in fact that this comic actually have been we have actually forwarded to our UNIMAS Global, because we talk about how the students' creativity can actually portray in a way that in this particular sense, because this comic is itself is original. I mean, it is it's not something that we copy from elsewhere, but it was created. But of course, that if you look at the message, it's nothing new, because we still talk about how to wear masks, physical distancing. But it's the concept that where they can think when they draw the cartoon, and then they talk about the coloring, the message, the simplicity of the matter that actually can match the age group, for the primary school children. It's just that it will be, I think you're very right. Ideally, we should test it out in the field lah, particularly give it to the children and ask them, did you understand this message? But it was not, it's beyond that posting lah, because the objective was actually at that moment of time was a bit different. Okay.
Okay, thank you for your explanation, Dr. Cheah. There is a question from Dr. Hashimatul. She asks, do they draw the comic by hand or any apps?
Actually, it's by hand.
I see.
Because this particular artist, actually our student, he has the talent of in fact that he's doing quite a few of freelance where he actually draw, and comic is one of his skills, which I discover later, because I was quite curious. I say that, wow, how do you manage to come up with something that I never seen before? So they revealed that they say actually it was hand drawn by our own students. So in future, if you want to look for artists or anything freelance, I'm most welcome to introduce him. He's doing a freelance work. Yes.
Yeah, Dr. Ashley would like to ask question. Yeah, please.
Hi. Good morning, Dr. Mazlina. Good morning, everyone. I hope you can hear me clearly.
Yes.
Lian, the question is, this is alternative assessment. Was it part of the summative, or was it just a formative assessment for the students? Number one, and then the other aspect is that this is very subjective. So how did you actually grade them in their creativity and all that? If you could help on did you have a rubric, or was it how was it based on the assessment? And then the other thing I didn't catch, maybe I missed out when you were presenting. This was done in a group work, and the thing is that how many students were there in the class, and how did you give the assignment to the class?
Okay. You have slowly. I hope I can remember everything. Your
Okay,
questions such a
I
long.
know, there's too many questions in there because it was all very interrelated to each other. So that's why I
Okay.
asked them, also I'll help you to tell you what.
Okay. Okay. First of all, they have element of formative and summative. What we did actually in the beginning is that everything actually done online. We actually interact with the student online. So I have a few sessions with the students via Zoom, all that to actually explain. And we also have some form of discussion. So what happened is that in the assessment, we have used the rubric for the proposal, because if you look through my slide before, we assess based on their research proposal and then the output in the form of the comic as well as the oral presentation at the end of the posting, because we have to capture all this in the form of 30%. But of course that all this is a part of we call it continuous assessment. The end of the posting still remain in the form of exam, which is because this is only 30%. We still have the other aspect of the clinical, the theory on all related to public health. This 30% is only for the research component. Okay, and what else that I miss?
Yeah, I
Another.
think you encaptured everything in one that short
Yeah.
answer. Yeah.
And of course that I also noticed that it's a group work lah. It's a group work in the sense that comic might have drawn by only one student, which I want to reply to Prof. Chew's question about how many students actually drawn the comic. It's only one student, but the group work coming in is when they have to develop the research proposal, where they have to do the research, literature search, all those things. Because when I ask them what is the concept behind using comic as a form, a method of creating the health education, they will have to go back and read through all these things about what is the concept behind comic as well as graphic narrative, all these things. So there's in fact that I have the proposal where they explain how they develop the concept and what are the tools they come in to produce the comic as the output. They have that. And that proposal later on was turned into a manuscript where they talk about how did they, at the end of the day, produce the comic, and then how do they gain the feedback on from the peers on the output lah, the comic itself. So we have two output: oral presentation in written. No, sorry, research proposal in written as well as the manuscript. Then the part on the so-called the oral presentation is for us to actually try to understand their experience, where we ask them, do you find this is good? Do you find this is different from before? Because in fact, it's actually different. So that process actually, we have a rubric to actually capture. But the rubric only focus on the research proposal plus the manuscript in the oral presentation, but not on the reflection and all those perception, those things. Those are the additional thing that we add on to actually understand the process. Because as I say, at that point of time, we were trying to create that amount of work equivalent to 30 students. I think it's 30 to 30 over student in the group. Because this is one
The
rotation is about 30 over
While Lian,
student.
the proposal is done as a group work. Research proposal
Yes.
is submitted as a group work. Okay. Okay.
Yeah.
Thank you. Very clear.
Thank you, Dr. Ashley, and thank you, Dr. Cheah, for the answer. Is there any other question? I think there is one question. Prof. Chu is already, you already answered, right, Dr. Cheah?
Yes, yes,
So how
yes.
many students have actually drawn the comic? So actually, it's only one student.
Yeah.
Dr. Cheah.
But as I said before, this because this is the one group. I have another group which is beyond this scope lah. But the other group, when they develop the video and the song, that one is actually a group of people lah. But drawing, you just cannot
Oh,
have too many. So it is because it's two groups actually that time when
I
I was asked to
see.
oversee. But the concept is the same. We are just looking at the other method of creating the assessment, because as I mentioned earlier in my slide, I say that 30% have to be accountable for this number of students, so they have to produce the amount of load of work to reflect as a group work for 30%.
Mm. So that other group, they have to do like other tasks. It is, Dr. Cheah?
Yes, correct.
So this group only
So
using comic as their assessment. It
correct.
is?
Yes.
Okay.
Mm-hmm.
Okay, now understand. Trying to understand
Yeah,
the component
because
of the subject.
because as you see before, because that is the time during the so-called very strict MCO lah. But currently for our new cohort, we are going back to the original idea of doing what we call it community survey, but we are trying to go into what we call it online survey lah. But we were still having the element of research proposal, survey research, but maybe the intervention program would be a little bit off lah, because we cannot have a so-called face-to-face engagement with the community. But the whole concept in the whole community is that we have a lot of things that we can improvise and try to achieve the objective of the course.
Mm. So, Dr. Cheah, I also would like to know, when you mentioned that the student using comic for the assessment, so how would you graded them? Are you only graded on student reflection only, or is there any grade or is there any response from community or from other people who are read their comic in the Facebook?
We don't actually looking at the feedback from their peers as a part of the assessment marks. But from what I have, because I have another colleague of mine that Dr. Rosalia, she is the expert in the health promotion. So we actually get her input in terms of giving marks on
I
whether
see.
they so in that case we cover on the aspect of the quality as well as the content of the health promotion, because in our course itself we also have some classes where we expose students pertaining to health promotion, health education. So Dr. Rosalia input coming to give marks as well on the comic lah.
So just now you mentioned about assessing student attitude and skill. So how you conduct this survey, Dr. Cheah?
That part in the you see, if when we do the what we call it the research proposal, all those things. Of course, there's a lot of interaction with the student, although there are 30 over of them. So although that it seems that will be good if we have face-to-face, because previously when we go to the field, we have actually interaction with the students. So we know which student, all this we call it the soft skill, everything. But now we can't really see. So I actually find that when we create it, we adjust the rubric itself, we might have to consider that part when we cannot assess their perception. But having said that, to me, if you look at the current, we call it idea, when we talk about assessment, it's no longer about we assess the student, but we also want the student to share their perceptions about their achievement. So that's why the part when we ask them to fill up all this survey, when we created in the Google form, that's where we started to understand. We say that, oh, so what we have impact from the beginning of the posting actually is it can be, like reflect by the student and say that, oh, this is the correct pathway. So I think in future, our assessment, we should have both ways to see. It should not be the traditional way when we cikgu have all the say. So that's why we have to move a little bit towards that lah. That's why when we put up our final marks or that, we look at this some of this perception and as well as their so-called their we call it reflection, as to help us to actually give the marks.
I see. All right. So it is interesting, Dr. Cheah, because we already moved towards another way of doing assessment, right, to the students.
Yeah, because it's just that in future, of course, that I think you have heard the word of peer assessment. Peer
Correct.
assessment means the peer itself it could be one of the way. It have to be two ways lah. Otherwise, you cannot forever think that you are the one that know what they are doing. In this case, it's very difficult because we don't see them face to face. So
Correct.
that perception comes in to help us to more or less have an idea.
So means for student reflection and assessing student attitude and skill is also being graded by lessons.
But of course that is not objectively dropped into our so-called, we put a component, but it actually in a way that help us to make a decision how much we want to give marks.
Understand. Yeah. It's become indicator for you before you.
Yeah, it's an indicator.
give it.
It's an indicator because you at the end you look at properly and say that okay, fair enough. You say that they're done well, but is it really done well if they don't give you any confirmation in written or in this data? So this data actually help lah.
All right. So last question from me. From your point of view, Dr. Cheah, do you think that this type of method, like using comic, using music and so on, will be continued after this? Even though we have opportunity to have like face-to-face classes or face-to-face intervention with the community.
I think that from the perspective, I mean, in the context of our community posting, this is very, it can be something new. I mean, it's something that help because previously, when we go down to the field, when we have so-called intervention program, because you remember in the beginning, the original assessment involved conducting an intervention program. Intervention program, we focus a lot of all the method, all that, but we always bring in talks, exhibition, health screening, all those things. But right now, we are looking at another way of being a bit innovative because of the restrictions in the face-to-face interaction. So this can be something that pop out and we call it new thing. Just like we talk about, I'm sure a lot of people are doing the infographic. You see, infographic. So we are just looking at the tools, but we do not actually understand the process of developing the tool. So this should be, to me, in future, we should look into that aspect because it's the process itself actually will create we call it the concept of personal identity development, PID, in the first place when I talk. It's the process that we are, because previously we only focus on the output and then the community. Yes. So I think we should look forward to that in improving our method of teaching and assessment.
I learned a new word, personal identity development. This is interesting, Dr. Cheah. Yes.
Okay.
All right. I think to all participants, if you have any question, you just need to unmute your microphone. Okay, so if there is no question, thank you very much, Dr. Associate Professor Dr. Cheah, for insightful and informative sharing. And I would like to conclude our workshop today. This is a very, I think, this is an innovative way of alternative assessment. So I think it will provide a new idea to all participants as well as to all academicians in order to come up with the innovative assessment so that it become like enlightened to us in order for us to create a new way of doing assessment, because it might be kita tercari-cari, we are trying to find any other what we call any creative way in order for us to do the assessment with the student. And then the I think the new term and word I learned for today is personal identity development, so that we will consider in terms of the development among students. It's not only we are focusing on the outcome only. So I think thank you very much, Associate Professor Dr. Cheah, for your valuable method in doing assessment. So I really hope that all the participants and academicians will implement this new way of assessment. So thank you very much for your time and participation in this session. That's all, Dr. Cheah. Thank you. Thank you to all
Thank you. Thank you,
participants.
everyone. Okay, see you. Bye.
Bye.